How's my people doing? Hello, hello, ladies and gentlemen, and welcome to another broadcast. This is Focus on Liberia. My name is Dennis Jai, and we are broadcasting from Atlanta, Georgia. Tonight, we're going to be discussing the coronavirus epidemic, the coronavirus pandemic. We have specialists, experts, and people that are fighting the front line who's going to be sharing with us tonight. So for now, please share the show. The song by our own man, Lucky Shango, say, how my people doing? I hope all of you are doing okay. So let us have a good time. Let us jump and shout for joy. So we want to have a good time. Let us sing and clap our hands. So let us have a good time. Let us jump and shout for joy. Once again, want to welcome you across the globe. This is Focus on Liberia. Our topic tonight, we're going to have a panel discussion on the coronavirus pandemic. My guest is a hospital administrator, Eva Sahr. Eva, welcome to Focus on Liberia. We also have a nurse, a BS, and also a graduate student, Mrs. Abigail Tyler, we call her Abby. Abby, welcome to Focus on Liberia.
Thanks for having me.
Last but not the least, we have our certified internal medicine and infectious disease physician, Dr. Joanna Shaw-Kaikai. Dr. Kaikai, welcome to Focus on Liberia.
Thank you.
We are so excited to have all of you. I want to say thanks so much for accepting the invitation to be here. We want to start by welcoming also our viewers from across the globe who are watching via Facebook. And please share the show if you're watching this. We want to keep our people informed about the coronavirus and what to do. So here we're going to talk about everything you need to do concerning this pandemic. So briefly, we want you to just your introductory remarks, a little bit about yourself, and just say something to our audience. And we're going to start with Eva, who says this is her second time on the show. So Eva, you're used to this business. Let's go.
Yes. My name is Eva Sahr. I work in hospital administration. I work for a hospitalist group at a local hospital. And what the hospitalists do is they work. They're internal, most of them are internal medicine doctors, but they work within the hospital settings, and they're the ones that admit the patients and discharge the patients and do consults for the patients. So I manage the operations of the office and make sure that, everything is okay with and running smooth in the office.
Thank you so much. Next, we go to Abby Tyler, who's joining us from Philadelphia. Abby.
Hi, everybody. Hi, Dennis. Thanks for having me again. My name is Abigail Tyler, also known as Abby on Facebook. Hi, my ATHL family. I'm a nurse, a registered nurse. Also, I'm a graduate student. I have experience in, I've been a nurse for about 22 years. I have experience in long-term care and home care. And for the past 20 years, I've worked as a cardiac nurse. I work in a telemetry floor, which is like step down ICU. I'm also a certified RN preceptor, which I teach a lot of new nurses. And I also am certified to teach on the nursing assistant class in the state of Pennsylvania. So I'm happy to be here, and hopefully I can be of some assistance. I would thank God I was able to make it. Apparently, my aunt's party was supposed to be this weekend, but because of the virus, everything was canceled. So I'm just going to take this time to say happy birthday to Pauline, and hopefully we get to have this party eventually sometime this year. Thank you. Yeah.
And if for any reason they still can't have the party, we can do a live party show right here on FOM.
That would be very nice.
Yeah. Let me bring on Dr. Joanna Shaw-Kaikai. Doctor, your introductory remarks.
Good evening again. Thank you for asking me to be on the show. My name is Joanna Shaw-Kaikai. I've been a practicing internal medicine / infectious disease physician for the past 11 years. And for the past almost 4 years. I have been working in public health, and I'm the public health infectious disease physician for my county.
And which county is that?
Oh, I reside in Nashville, Davidson County, Tennessee.
All right. Here, I was looking on the internet, and before we even start the discussion, I want to get some update about the coronavirus in your state or in your city. Here are some things that I'm reading off the internet. One, Maryland, let's see, New Jersey COVID-19 cases swelled to 1,914, including 20 deaths. Pennsylvania COVID-19 cases rise to 479. Philadelphia reports 96 cases. Senator Rand Paul tests positive for coronavirus. The 4th TSA agent at Orlando International Airport tests positive for coronavirus. The city of Tucson installed public hand washing stations around New York. Coronavirus cases jumped to more than 15,000. And so let's start by saying, how is it to where you live? Let me start with Abby, and wherever you work and the city you live in, how things?
Well, I live in the greater Philadelphia area, and the county I live in is borders Philadelphia, so we're like a metropolitan area outside of Philadelphia. I don't know the exact, I think you just quoted our cases so far, but it's not pleasant over here, and it's getting scary. But you know, the official right now, our Governor Wolf, is actually on live on Facebook speaking about the current numbers and all that. So I guess I can look at that later. But right now, I work with like 5 different hospitals close to where I live. So we're all trying our best to keep the public safe.
And then one more, let me report from Georgia too. The coronavirus cases rise to 600 in Georgia, 23 deaths reported. Dr. Kaikai, how is it in Nashville and Tennessee as a whole?
In Nashville, the cases are rapidly rising, and we're at 150. Last time I checked, it could be higher in the past few hours. And in Tennessee, I believe we're close to about 400 something cases last time I checked.
One more news here.
One death in Nashville, Davidson County.
Oh, wow. 38 positive for coronavirus in New York City jails, including Rikers. Eva, how is it there in Virginia?
We have some confirmed cases and some deaths. I don't know the exact numbers, but we don't have any confirmed cases at the hospital yet, but we're testing a lot of people there. It's a little scary. I mean, like everywhere else, they're reporting supplies are low. The doctors, their morale is, low. We're trying to keep them motivated and ourselves, but everybody's just trying to keep their head above water and do what we can do to get over this.
Okay, great. Dr. Shaw-Kaikai, let me start with you. You're an infectious disease physician. First, tell our viewer what that is, what you deal with, and I think that COVID-19 will fall within that.
Yes, it does. An infectious disease physician, you're trained to treat anything from pneumonia that's caused by a bacteria or a virus to HIV to managing COVID-19. Some infectious disease specialists tend to specialize in tropical medicine or in just HIV care. And I tend to do a little of both, of all, I should say. But right now I'm not treating people who are infected with HIV, AIDS.
Wow. Abby, are you any case in all the 5 hospitals you work in? What's your involvement? Have you come in contact with any positive case, or what is the deal?
Of correction, I work in one hospital. I have 5 hospitals around where I live.
Oh,
So
okay.
So, or also, Dennis, you and I go way back. So I forgot to add in my introduction that I also belong to our local Liberian Association. So I also conduct annual health fairs for them in our city as well. So
And
as
you
far
also
as
you also host your program live, which is Healthy
Abby,
Living.
yes, Abby Tyler Healthy Living, yes.
For sure.
Okay, as far as the COVID-19 patients, so far what we're doing in our hospital, we have a certain floor that's just dedicated to patients who come in that may be suspected of it. We treat them we test them in the emergency room, and then they come out to different floor. As the nurses in our hospital, we're rotating on that floor because when you're in that floor, you're there and you have all the supplies that you need. So the patients are not in the general population of the hospital, and you're not exposing anybody else. So you're only in that on that unit, which is closed, and everything else, the protocol that we're supposed to follow set by the state, our institution, and also federal guidelines. So we follow that. So you're only taking care of those patients. You and another nurse, I think it's like 3 nurses now to a certain amount of patients. But so far, I haven't had anybody yet, but like I said, they said we have to treat everybody as if they're, infected, and treat yourself as if you're infected. So of course we're following all the protocols that we're supposed to do. Wash your hands as nurses, do everything else, that protocol, like I said, set out by our institution and the state and the federal guidelines as well.
And Eva, you work in the hospital as the administrator. I know that should be difficult because, how do you protect yourself? What is the protocol there, especially regarding those who are not medical practitioners? What are you doing there?
I mean, for me, I have to be in contact with the doctors constantly. I've shifted to coming in very early in the morning. I come in, I go on the floor because there's 2 offices. Where my office is, there's no patients there. But where their office is, you have to walk through the patient's ward to get to where the office is. But like Abby says, they have a separate area that they're treating the patients that they might suspect might have COVID-19. Nobody's really coming on the floor unless they're in the emergency room. So I come in the morning, go up to the office, do what I have to do for them. And then I go downstairs, and most of the time they don't see me for the rest of the day. And I try to, we communicate a lot through emails, through texting. I call them. So that way I have minimum contact with them, because with them treating patients with the lab coats and things like that, I just try to stay away and just stay in my office.
Ladies and gentlemen, if you're just joining us, this is Focus on Liberia. We are discussing the COVID-19 with Dr. Joanna Shaw-Kaikai, Eva Sahr, and Mrs. Abby Tyler. So let's get into it. Dr. Shaw, let me come to you. What is this coronavirus 2019? Is it being called by a different name? What is it? Where does it originate? Is it airborne? Just give us a little, intro on the COVID-19.
So we know WHO is now trying to not associate a certain infection or epidemic or pandemic with a certain area, so that area is not stigmatized. So the COVID-19 stands for coronavirus disease, and for the year 2019. What we do know is that COVID-19 started in Wuhan, China. It's it is believed to have started in a market that had live animals and other produce, in the marketplace, and which animal is the source that then that virus changed in and was able to infect humans. That is not exactly known at this time. But it then was able to spread person to person. And that was one thing that was not known at first, whether it was just infecting people who had come in contact with it from an animal source, or or was it person to person. We all know now that it was a person to person spread also. And unfortunately, we realized that a little later on when there was a lot of person-to-person transmission going on in China. You want me to go on? So coronaviruses are around us. Coronaviruses cause the common cold. So, you get the achiness, the runny nose, but this one is different because the human body is not used to this coronavirus. And the usual coronavirus that causes the common cold is an alpha. Those are alpha coronaviruses. This appears to be a beta coronavirus, which is similar to, if you recall back to SARS and MERS-CoV. So it appears to be in that group of coronaviruses. And unlike the common coronaviruses that are all around us and cause us just to not feel well, and one appears to put the body into overdrive, and where it can then cause the body to have a big response, and the lungs can fill with fluid, and also it can progress to pneumonia. So that's the difference between the usual coronavirus and this novel coronavirus. So that was what was first being called novel coronavirus. Would have been another term for it.
So what's about this thing about it being airborne or droplets? How is it spread?
So it is spread primarily through the air. Now, is for those of us who work in healthcare, when we say airborne, we're usually talking about the tiny particles, but the droplets also come through the air. So it, based on your question, it is spread mostly through droplets. It's possible for it to become aerosolized into smaller particles, but most of it is through droplets. So the bigger drops that are falling, and those can fall on the eyes, on the nose, on the mouth, and those get then carried into the nasal cavity, into the back of the upper throat where it can reproduce. We do know that also it's possible for someone to get the virus if it's on the surface. Let's say someone coughs or sneezes who has the coronavirus, and someone touches that surface and then touches the eyes, the nose, or the mouth. And transmission can occur that way. But again, primarily it's with someone who's infected, coughing or sneezing into the air, and then those droplets landing on the face, somewhere on the face. Or you breathe it in, excuse me.
Abby, you're nodding. You want to chime in?
No,
Go ahead.
I mean, she's saying that because in addition, it is airborne, and like it says, also you can get it from touching surfaces that haven't been cleaned off or sanitized after somebody else who was infected with it has touched that surface. So because of that, we who take care of these patients, we have all been fitted with our N95 masks. Everybody was already fitted before. That's like by law, you have to do that because we also have patients that come in with tuberculosis, and you have to be covered up completely for that. So we've already been fitted for that. The entire hospital, all the nurses and everybody who goes in to see the patient, respiratory therapists and all. The other staff members who are like non-essentials don't usually go in the room. So it's usually just the nurses, nurse assistants, and respiratory therapists and doctors who have to go in the room. So we have to be completely gowned with the mask and N95 mask. Sometimes we have to wear the shield. The nurses and people who are going to be testing patients outside, because we have a special place where they're testing patients that are coming, not basically from the public, but patients who have doctors' orders, prescriptions to come and get tested. Those nurses are being completely gowned completely. The ones that are taking care of the patients in the hospital, like I said, the floor that we're going to be rotating back and forth. Yes, we also have to be completely gown, to wear our masks and everything, and the eye shield, because like she said, if it goes into your mouth and nose, those are all your mucous membranes, and those, your mouth, your nose, your eyes, and all that are very porous, meaning anything fluid can easily go into that part and go into your body. So that's why everything has to be protected. So mainly that's the reason why when people start coughing or sneezing and it goes in the air and somebody else breathes it in, that's what causes, for somebody else to get infected. So that's part of the isolation and part of the airborne thing she was talking about.
How is this diagnosed, doctor? And if it is diagnosed, then what? I know there's no cure. So what? Pray?
Well, we always need to pray, whether there's COVID-19 or not. So right now, the only test that's available is for diagnosis of COVID-19 is a PCR test. And that is a special laboratory test that checks for the viral particles from a specimen that's been submitted to the lab for analysis. And so it could be whether they swab the back of the nose or the back of the mouth, so oropharyngeal or nasopharyngeal. And some places might also still be doing the blood test. In our state, we're no longer doing blood unless it's done by a private institution. And then those specimens can be submitted to the lab and they check and see if there are any of the viral particles that are detected in those specimens.
Then what? If you're positive.
And then if the person is positive, then, you said, oh, you're positive. Now, the good thing about COVID-19 is that most people do not require hospitalization, and most people have a mild disease. So they can go home and, keep themselves hydrated. If they have a fever, they can take ibuprofen or Tylenol. And I know the question has come up whether ibuprofen or Tylenol. And there is no firm evidence that people who have COVID-19 should not take ibuprofen. There are some people who cannot take ibuprofen. Maybe they have asthma or some other reactive disease that prevents them from taking ibuprofen because they're sensitive to it, or they have some kidney problems that prevents them from taking ibuprofen, and they can take Tylenol. There are some who cannot take Tylenol. Let's say they have an advanced liver disease, and so but it's okay for them to take ibuprofen. But whatever it takes to help bring that fever down, help them feel better, keeping well hydrated, resting, and usually they'll advise that you keep yourself isolated, which means don't go out into the public sick and all that for at least 14 days. Some health departments are moving towards 7 days. Once the person starts feeling better and has been without fever for about 3 days, then 7 days later, they can remove from isolation. It's also important to identify those who have been in contact with a COVID-19 case, because it's important to try and stop the spread. And how do we stop the spread is to isolate, quarantine, and quarantine is for those who are healthy. So if someone has been in contact with a person who was confirmed to have COVID-19, that person should be quarantined for 14 days. And why 14 days is because that's the incubation period for the virus, in that somebody who's exposed to the virus and it has gotten into their system, they may not show symptoms for up to 14 days. And so if that person who is quarantined, and remember, quarantine is a healthy person that is not going out in the public and monitoring whether or not that person has, will develop symptoms from the virus or actually has the virus. And in our county, we check those who are quarantined. We monitor them once a day. Some places it's twice a day where they're checking their temperature. We call and ask, what's your temperature? How are you feeling? And each day that is done for 14 days. And then that person can be released from quarantine. And, things are rapidly changing. So if their job, they still have a job and the job, their, place of work is not closed because of this current pandemic, then we write a letter if they want us to, saying they can go to work. We don't say why they were, told not to go to work, to protect their privacy.
So what are the symptoms?
So the symptoms most commonly are fever, and usually the fever will be 100.4 or higher, cough, and shortness of breath. We know, again, a lot of people have had mild symptoms, so that is adding to a little bit of the confusion and who to screen and who not to screen, or who to test, and who not to test. But those are the major symptoms. You also read, as this COVID-19 pandemic is going on, that, there have been some people with reports of, I think in children, some have had some runny nose or sore throat. And there have been a few who have had even some loose stools or diarrhea. But predominantly those three features, the high fevers, the cough, and usually the cough is non-productive, and shortness of breath are key of COVID-19.
And Eva, Abby, feel free to jump in anytime with question, comment, backup, or anything.
And to add to that, sometimes the symptoms are no symptoms. There are a lot of people walking around who are infected with it that have no symptoms. Even recently, the Senator Paul that was just diagnosed with it, he had no symptoms. He just got tested because he said he had been traveling a while, and out of abundance of caution, he got tested. So sometimes there are no symptoms and you could be a carrier. That's the main reason why they tell the younger ones who think that they can get sick from it, or that they can't contract it, that yes, you can contract it and you could be healthy and you can infect people who live in your household, your grandmother, your mother, any elderly friend or relative, that you're putting their lives at risk because you're a carrier. So you may have no symptoms. That's what makes it even more difficult too, because it says stay home and stay due to social distancing, because sometimes the symptoms are no symptoms whatsoever. So that's another complication that we have to worry about.
Eva, do you have this test kit at your hospital, and or the supplies? How is that going?
We have the supplies, but one of the challenges is getting test results back in an accurate time frame. Right now, there's only like 2 places, I think it's Quest and LabCorp, where we send the test, and some patients are taking up to 4 or 5 days to get the results back. So at that point, what the doctors are doing is sending the patients home. I talk to some of the patients, and they call, for the results. I talk to them, but it's taking some time to get the results back. And I know they just approved the rapid testing, which is good. But it's taking some time to get those results back, and people are, anxious and have anxiety, but they're doing what they can.
Some other hospital, they don't have this test. They don't do the test.
Yeah, some people are sending people to the health departments to get it done. But our hospital, we test them. They're flagged in the charts while they're being tested. I know their names. Sometimes, like I said, they call, or I call sometimes even to say, to check on them or things like that. But it's it's hard, you know, especially with the healthcare providers. You know, you want to tell a patient what they have, but especially with this this pandemic, but sometimes to get those results back or even the tests is taking some time. And we're trying to limit the amount of testing, so there's more triaging going on of the patients to make sure, okay, is it something else that they're having? Because some people have like COPD or have other things, and they might come in with those symptoms. So you have to really triage and see who needs it and who doesn't need it.
Dr. Kaikai, the treatment, I know we talk about prayers before is one big treatment. Now people are telling us about chloroquine, vitamin C, Jolobo, or you put a hot water in the bucket and cover yourself, and all these things. Let's talk about the treatment of this disease. There's a lot of things out there. Which one is false? Which one is true?
Say one thing about the test is that for in an ideal setting right now, a test result could be back within 3 to 4 hours. But because of the staff shortages and just so much demand for testing, that pushes it to 3, 4, 5 days in some places. But if the labs had all the staffing they needed, I mean, yes, that was required to run these tests, we probably could have those results back in 3 to 4 hours. And as far as treatment, I think I mentioned earlier that the supportive care is what they talk about. I know you had asked some questions as far as some of the things, gargling with warm and salt water. If it helps the throat to feel better, that's fine. See. I think drinking as hot as you can, water with lemon in it. I know lemon has been, said to have a lot of good effects on health, including immunity. I'm not sure if those have been confirmed, but if the water with the lemon tastes better to you, that's good. I would advise that you be careful with the temperature of the water. And you should know that when they did the testing of the virus with hot water, it was actually 130 degrees Fahrenheit it took to kill it. So please do not try to get your water to that temperature. I mean, that's enough water to damage your inside completely. That's enough to take the skin off your body. So if a little bit of warm water with lemon in it helps you to keep hydrated, and that's important whether we're infected or not infected, then go ahead and have your water with lemon. The boiled garlic water, again, garlic is one of those that have been said to have a lot of good effects on the health. If that helps you to keep hydrated, go ahead and do that. We do know there are several medications that are being looked at. One is remdesivir is an antiviral medication, and now the NIH, National Institute of Health, has clinical trials that are going on. The FDA is allowing some facilities to use it as a compassionate drug. We know that remdesivir was antiviral medication that was actually initially produced by Gilead for Ebola, and it's still it's in its clinical trial phase. But it has shown some promise. In the news lately, there's been trials with hydroxychloroquine and chloroquine, and I think as Liberians know those medication names. because those are used for malaria treatment. And in the US, hydroxychloroquine tends to be more available. And so that has, those two meds have shown some promise. Also, there's been the talk of hydroxychloroquine and azithromycin, using those two together in some areas of China that has shown some promise. A concern with that is that both of those meds can cause some interruption of the electrical activity of the heart. They have the potential to, so one would have to be careful. There's been the use of HIV medications. We know the HIV is a virus, human immunodeficiency virus. So the thought was, well, what about using one of the antivirals, Kaletra, or the generic name is lopinavir, ritonavir. It's two medications in one, and it caused a lot of the Chinese patients to have a lot of diarrhea. And so that didn't appear to be a drug of promise, because it was just so many GI side effects, which is one of the side effects of the medication. And one of the things, if you look on the WHO website, you know, our people, we love antibiotics. But one of the things that WHO, the World Health Organization, is pleading is that please don't go out and just buy antibiotics and think that will help protect you against COVID-19. Because COVID-19 is a viral disease, and most of the antibiotics tend to fight mostly bacteria. So there's two different things. I would leave it to the experts to recommend which anti-infectives to be used.
We have a question on Facebook. Okay, go ahead, Abby, before I read my question.
Also to add to what she said, those medications are being given to patients that are in the hospital and they're being followed closely. So, and the small amount, everything is still in the clinical trials. So when I was on Facebook and people were saying, oh, you know, who got some chloroquine out there, people have to remember when we were back home, people got chloroquine off the market. I don't remember ever going to a doctor's office. Thank God we had a nurse that took care of everybody where I lived. Never ever went to a doctor's office. There was never a prescription written for anything. So anybody could go out there to any market, opium market or the store or the shop, wherever, and buy chloroquine. So if you were a child and a 50-year-old person who were getting the same dosage, somebody who doesn't even know anything about medication was selling it out. So a lot of people were having like severe side effects. I mean, intense itching, hallucinations, ringing in the ears. There were some people, I'm sure, like she said, electrolyte balance and all that too. I mean, overdosing or underdosing, you can suffer like severe. I'm a cardiac nurse, so I don't want to go into like the deep clinical part of it, but you could die from that. And I'm sure a lot of people die from that back home. And back home it's either God wanted you or it was witchcraft. So please, don't go out there. Don't ask any of your friends to send you any chloroquine from back home. This is all initial stages. Listen to the experts, please. Those who have knowledge in it. Don't just listen to somebody who said, and I don't want to get political, but like I said, listen to the medical experts. Okay, those who have practice, who have degrees in it, not Dr. Google and not Dr. Politician. Listen to the experts. So make sure, don't call your friends and say, send me some chloroquines and send me this and all, because if you're taking these medications and something starts happening to you, we're trying right now not to have anybody in the hospital that doesn't need to be there. So when we have people who are still having strokes, who are still having heart attacks, asthma, exacerbation of COPD, so many other diseases that are going on, we need to keep the beds for. So please don't self-medicate. Okay, those yes. medications that she spoke about, they're giving to people in the hospital. They're being closely followed. If you're home and you get tested positive, they tell you to self-isolate. Make sure you stay hydrated. Drink a lot of fluids, preferably not alcohol. A lot of water. Keep yourself hydrated. Wash your hands. Make sure everybody is eating healthy, exercising. Don't forget to exercise or just stay active, because they're stronger your immune system, the quicker you're going to be able to get this virus out of your body. Most of the people who will get infected with this virus will not have any effect or will have early mild effects if you don't have pre-existing conditions or if you're not an elderly person. So please, 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 please make sure when you hear something that just flashes across your screen or somebody says them, either like you have to go back and read more about it. And don't think everything is on Google. Anybody can put anything on Google. So like that's what I said. Make sure you go to reputable sites like the World Health Organization or CDC. Speak to your family doctor. Don't go stepping up there either. Please call first with your family doctor. Listen to your health department and get information from people who have a degree in this. Not just anybody can just tell you anything and you believe it. Okay, so please keep yourself safe and your family safe out there by listening to people who have a degree or education in doing this. Okay.
And Eva, you
Yeah.
said you got chloroquine already?
I don't take chloroquine. I am highly allergic to it. I almost died as a child. So don't bring it anywhere near me. If that's the only cure for coronavirus, then I'll just pray. Yeah. But like she's saying, and people don't realize, and even like when you take your kids to the doctor, they tell you, especially for antibiotics, not to give them too much and not to overtake it, because you can become immune or whatever. When you do need it to work for when it needs to work, you've already put so much in your system that it's not going to work the way it should work. So listen to the doctors and stay away from taking chloroquine or getting yourself in trouble. Then you're in the hospital and then it's just not worth it.
Right.
And if anybody's selling chloroquine on the open market, one more thing, if you buy them on the open market in America, because you can order anything online, I guess, you're not even sure whether you're taking the raw drug. So just remember that. And if it's coming from anywhere else, there are other fillers that they put in the pills and all that may not be safe. So please, once again, don't self-medicate. Please listen and check with your family doctor.
Our American system is not the same as the people's system back here. So be careful.
Especially people back home.
Not the same.
But you can go wrong with Jolobo.
Ooh. I will leave that one alone.
Was it Jolobo just for a stomach cleanser? I don't see any reason why you take
it's multi-purpose because it's very bitter, just like chloroquine. So they use it for everything.
I will attest to Jolobo because when I was sick, that's all my mom used to give me was Jolobo. So I can attest to Jolobo. But chloroquine, no.
Just remember, if you take Jolobo, like I would say, if you do anything naturopathic medication, when you come to the hospital, we're going to be treating you with the Western medicine. So please make sure if you're taking Jolobo at home, please learn the scientific name. So when you come to the hospital and they say, well, what did you take? You know, so they can look it up real quick, because every minute that goes by, you're getting sicker. So they're going to be trying whatever's in the box that's there to keep you safe, to get you back to where you need. So if you take anything that's naturopathic, that's why when people come to the hospital, you come to the doctor's office. When we do your history and everything, we ask you, what medications are you taking? I did this on my forum. What medications are you taking? Any medications that are diagnosed, over the counter, anything herbal, please make sure, by the way, yes, future reference, make sure diagnosed prescription medicine, anything over the counter, like if you're taking ibuprofen, Tylenol, whatever, and anything anything like naturopathic medicine, please make sure you let them know. All of that has to be listed in your history. Everything has to be listed among your list of medications. So if we have any kind of side effects, or we're looking at anything, we can go back and say, maybe this is this, maybe this medication interacted with this. And it's not always safe to take naturopathic medicine without knowing what it is, because you could be taking something and it looks benign, or it seems benign, it's like maybe not harmful, but it can interact with another medication that can cause really a deadly effect or something life-threatening. So please make sure that you notify your health professionals and everything when you go to the hospital, and tell them everything that you're taking so they can know that. But please, 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 if you're taking naturopathic medicine, please, please, please be careful and just run it by your doctor. Okay.
Oh, I don't even take the Jolobo. I'm just saying I took it as a child.
No, that's for general audience. I say that on my forum too. I did a whole thing about medications and all that. So I'm just, because I have a large audience now, so I'm just putting it out
Exactly.
I should say that Abby brings up a good point. People think because it's natural that it is safe or it's okay. And I tell my patients that, a lot of medications are based on natural products, on herbs and other things, but they cannot go and get that herb to mass produce it, or else the medications will be even more expensive. So what they do, they figure out the chemistry of it, of this natural product, and then they go in the lab and make it, and they're able to say, okay, this dose is good for this type of infection or this illness, or for this size of person. And so just because, as Abby's saying, because it's natural doesn't mean that it's all good. You have to be careful, and what you say, watch out for interactions with medications that are prescribed from a healthcare setting. And also, as Eva was mentioning, we have to be careful with how we have antibiotics in the environment, because we don't want to have resistance develop. We know with some of the tropical infections, unfortunately, the drug companies are not as interested in investigating new drugs for them. So we have to preserve the ones that we have.
Thank you. Ladies and gentlemen, if you are just joining us, we are discussing COVID-19, that's the coronavirus disease. If you want to call to join the conversation, our number is 605-313-6004. The code is 791403. My guest, Eva Shah, who works as a hospital admin, Dr. Joanna Shaw-Kaikai, an infectious disease and internal medicine physician, and Mrs. Abby Tyler, who works as a nurse and also a graduate student, so she's still learning book. Let's see.
I have allergies, people. I don't have the virus, so if you see me wiping my nose, I'm sorry. I'm just like, this time of the year, I have my allergies. I'm sorry.
All right. So Vivian Zokwe said, thanks for telling us, because I was thinking about asking for some chloroquine back home. So the program is having effect already. There's a question here from Musu Stewart. It says, some infected persons have recovered. Can you say how they were treated medically, since there is no cure? Do we know how these people were treated, those who recover?
Well, most people recovered just with supportive care, making sure to have enough fluids if they're dehydrated, bringing that fever down. And a lot of people recover at home, because again, as I and Abby stated, most people, more than 80% of people will not have severe disease. So most people will recover.
And if you take your kid to the hospital and say, oh, it's virus, your system, you just have to fight it. I mean, that's tough. Same with the COVID-19, just fight it. So where does it go?
If you're not sickly too, because usually those who get admitted into the hospital, those are the ones who have severe lung disease, or the virus attack their lungs to where they have when you say short of breath, you're like, short of breath, uncomfortable, you discomfort and all that. But you get to the point where you're like really gasping for air because you already have an impaired immune system, meaning like you have some other asthma, bronchitis, emphysema, which is COPD, all the whole cover. And when you get to that point, you running fever that you have taken Tylenol, ibuprofen for, that hasn't resolved over a period of time, and you're not able to keep any food down, you're not able to keep any liquids down, you're having severe diarrhea. Sometimes we have diarrhea, it's not always there, but you go, when you get into that point and you become to where you're very tired, you're laying around and you're not moving around, that's when we admit you to the hospital. So most people won't even get to that point. That's why they give you their results, and you can go home and, again, like we said, stay hydrated, rest, and over time your body recovers and you go on from there. But the ones who are severely sick are the ones that we admit to the hospital. So main thing is, don't come to the hospital if you're not to where you're very sick and you're not unresolved fever. Don't come to the emergency room either if you just think you have it, because call your doctor first, because when you come into the emergency room, you're going to be sitting in the emergency room that's open to everybody. So everybody who is sicker than you and have other diseases that may not even be COVID-19, that is transmittable through the air, and coughing, you're going to be exposed to all that. So please call first before, and your doctor will go over the symptoms with you, and then he or she can decide if you know, you need to be admitted to the hospital, or if you need to come to get tested. But most people, like I said, will recover from it if you don't have any diseases that's going to cause you to a difficulty in fighting the disease.
So this is a virus. So when you recover, where does it go? Does it die?
It's just
Yeah, your body gets rid of it.
yes.
What does that mean? Get rid of it?
Your body, so your immune system destroys it.
Okay.
You know, thank God for an immune system. So we have these fighters within us. You can say there are certain proteins, there are certain enzymes, there are certain cells that when they recognize there's an infection, they will come and try to get rid of that infection. And sometimes the body does such a good job, it gets so overly excited. And I say, sends all these soldiers that ends up harming itself. And that's where, you know, then the fluid can fill the lungs and other things just because the body has overreacted, you can say. And sometimes, you know, the critical care specialists will have to use certain medications to help calm that body down. And it's a delicate balance because you want your immune system to fight the infection, but you don't want it to get overly, you know, to become too excited. And so in those, you know, as Abby said, usually those people are in the hospital setting. And those are the people we want to go to the hospital. We don't want you to stay at home if you feel you're dying and say, oh, well, they said I should stay home. No, we do want you to go and get care. Right. We know on social media, there's something going around about holding your breath for 10 seconds. And if you can't, then that means you have COVID-19 and need to go and seek care. And that's not true because there are many people with underlying lung disease that cannot hold their breath for 10 seconds. Or if your allergies are very bad and you can't hold your breath for 10 seconds because stuff just draining, we don't want you to show up at the hospital. And then people, you know, there will be more use of, you know, the limited supply that's worldwide, you know, the masks, the gowns, and all those things that our healthcare providers are having to use.
And there's also word out there that this, even after you recover, it destroys your lungs permanently. Some, you know, how true is that, that you get severe lung damage after you recover from COVID-19?
Well, I mean, the spectrum of disease, you know, varies. Again, most people, there will be no destruction of the lungs. And some people there will be. I tell my patients who I treat with tuberculosis where they end up having holes in the lungs and other things going on. And when it heals, yes, I say it's like a scar in there. You know, you cut yourself badly on your skin or so. When it heals, sometimes there's a scar. Sometimes there ends up being scarring in the lungs, but that's going to be few of the people. And, you know, Abby mentioned earlier those who are at risk for having severe disease or those with, you know, underlying health problems, lung disease, heart disease, and the older age. You know, CDC says age 60 and older will be at risk for severe disease in addition to those with underlying lung, heart problems. So yes, there can be some scarring, but that would be not many of the people with COVID-19 disease.
We're expecting another guest from Liberia who's a physical therapist. Unfortunately, is not here. But let's turn our attention on Liberia and places like Liberia. How do we fight this? You know, what would be the advice for places where we don't have the same sophistication and things here, like hospitals, or we can afford to stay home. You know, we're working from home and all that. In Liberia, those facilities don't exist. So what would be our advice? Abby, let's start with you.
Pray. I was just on somebody's post today. I was like, they're saying you can just self-quarantine in Liberia. And I remember when Ebola virus came about, I was talking to one of our ID doctors infectious disease doctors, and I was telling him everything that was going on. He's like, I guess they're going to be praying then, because most of the people, in my guesstimation, most of Liberia and this Monrovia is so crowded, even outside of Monrovia, anyways. There's most of the people use communal bathrooms, communal toilets. So even if you said in America, you can say, I'm going to stay inside, me and my family, we only have our own plumbing inside and we can stay away to not infect our neighbors. Most of these people have the same, like they all go to the same toilets, they all go to the same bathrooms outside. They have, and places that have water pumps and all. Everybody's touching that. Nobody's watching. Nobody has time to wipe in between. You have everybody standing behind you trying to get water or trying to go into the bathroom. They're not. So if the resources, and then the hospitals are not equipped to take care of that either, because we all saw what happened during the Ebola crisis. So if the foundational resources aren't there, like, modern plumbing for a majority of the people, electricity, EMS, functioning hospital, the best you can do is, as much as you can wash your hands, not giving people water buckets and all that, but how clean is that? Because you still have to go get the water from the water pump, the water, even the markets. When I was there, maybe things have changed, but people were telling me there's no plumbing in the market there. So somebody's touching your food and they're giving it to you. So chances are more than likely they haven't washed their hands anyways, or they have touched so many other surfaces since then. So as best as you can, you just wash your hands and pray for the best. And maybe there other people have more to add to that, but like I said, if the foundation.
It's so hot inside, you can't stay inside. You have to come out. So I don't know how you can self-quarantine. Go ahead.
Yeah.
It will be really interesting because I listened to the Minister of Health, Dr. Wilhelmina Jala, this afternoon. And she said that, I forgot to write down when this goes into effect, but I think it's relatively soon, maybe within the next couple of days or so. But Montserrato and Mount Gibi counties, sorry if I said that wrong, people.
Yeah, that's
that they're going to be closing the schools, the university, the colleges, the bars, the nightclubs, the beaches. They're advising the religious centers, churches, mosques to close, and no gatherings of 10 or less, including for weddings. That's going to be tough. Funerals, and even the restaurants that there should be takeout only, and barbershops and salons, and to limit the spread of the disease. Because last time I checked, there were 3 cases in Liberia, and so far, thank God, no deaths. And as you all point out, that's going to be a great task, because there are so many reasons why that is going to be difficult, but hopefully the government will step in and help people to be able to keep to those things. Because we learned from Italy that, there were policies that were put in place, but if you don't help the people in so many different ways to be able to adhere to those policies, you have to give them, look for other things. You can't just say, stay inside and, there's no way for them to get food and other things. So, I was happy to see that, they're thinking of those things, but there has to be so much more.
Right. Yeah, I saw that too. Absolutely no street selling by both adults and children during this period. There should be mandatory hand washing with soap and clean water. And I'm like, okay, I'm at Waterside, where am I going to find this?
Clean water.
Community dwellers are asked to please report people. Okay, that can be done. And all health facilities. So I'm picturing, when I was reading this, I'm picturing the red light market where I was 2017. And there is just, you can't even go through the people. So I don't know how the social distancing is going to work. You are buying this food that's open. Thank God you can go home and cook it. But I never washed when I bought mango in the market. I never washed it and I ate it right there. So I don't know what have changed, if things have changed.
Which is normal because I think my reason for talking about healthcare in Liberia, my cousin passed away in JFK. I think it's been about 10 years now. She was a nurse there too. So, and I remember they were saying, she was found on the floor. And I said, well, why didn't you just pull the call bell? And they said, well, we don't have that here. I said, how can you have a hospital without a call bell? That's something that's legal in American hospitals that you have to have. And that's something we document every time we document call bell within reach, because the greater risk of falling and having, you could die from a fall if you have a head injury or, have irreparable harm. And so if you don't and so that's when I really started getting involved in healthcare in Liberia and, contributing to other groups that go back home and help out. But when you don't have the foundational resources there and you're telling people don't sell on the streets, that's their livelihood. I mean, they're not the kids and all the other people are not selling on the streets because they have nothing better to do. They don't have any other jobs. They don't have any other way of getting money. The government doesn't have that much money like over here where they're going to be giving us checks and all that to go through, even though it's not enough. But that is not possible in Liberia. Even the people who are working now are not getting paid on time, and so the government be able to hand out money to people to stay home. I mean, it's not. I'm sorry to sound, sound like Dr. Fauci. Just trying to just tell you the truth.
Yeah, but, Abby, let me bring this other one. Then you tell me. So what do we do? For instance, it said for public transport, taxis should carry no more than 2 passengers in the back. I think they take instead of 3, they take like 6 in that bag, and 1 person in the front. Before, right after the war, now they were taking like 3 in the front. So you are in the front there.
But I mean,
so
how many of the taxis, even after a customer, they go, they clean it off, or they make sure that it's sanitized, and 6 feet in a car, you'll be hanging outside the door and the other person will be hanging outside the other door. So at this point, and you can't say people can't drive around. It was Letby from your other show was saying that, we need to find creative ways of even people finding alcohol or things like that. I know she was talking about using maybe cane juice and a mixture of something else to make maybe sanitizers and things like that. But it's very difficult with us to distance ourselves and for people to stay inside. Like we eat day to day. So how do you stay inside? It's too late to plant your little potato green garden in the back to be able to say you can feed yourself. We can't do that. We just have to be careful, I guess. I mean, for the healthcare professionals, like it's not the time to say you're cutting people's pay or taking away people's pay and things like that. You have to reinforce your healthcare workers. Like some of the things we're doing here, we have a lot of temporary staff that we have. We're even reaching out to the different universities to see if we can, some of the students or who are doing their interns, how they can help us. Reach out to the nursing schools, see how some of the students can come in and help. Reach out to people that are retired, see, can they come in and help? But even with our doctors, like I'm looking at my phone, I just got a text from a doctor, he's a little scared to come in now. So he's telling me, he's for the next 3 weeks, he's not going to be coming to work. So, and I'm sure in Liberia, you're going to have a lot of those things where people are scared, even for themselves, and they're scared for their families. So, encouraging the nurses, encouraging them to come to work, doing little things for them, to help them to come in. It's a terrible situation everywhere, and there's not a specific fix for it. So,
a specific fix that's supposed to be in Liberia. I think the previous administrations and the current ones, I mean, like I have a friend on Facebook, I don't want to call his name, but he always say, like, we always like to paraphrase what he says, like we always like to pretend like what needs to be fixed hasn't been fixed and done and perfected somewhere else. Everything that Liberia needs to do has been done somewhere else. But so all you have to do is take the blueprint, and you have to take people who are willing politicians and to make the changes, even if it's just minor changes and incremental changes, so the next person that comes in builds on that. But it just seems like we sit there and we wait for a crisis to happen, and then we beg for help, and then they give us the help, and it's like we put a little band-aid on the situation, and then we go back to it again until something else happens. And so it's like, I don't know what it has to take. 3,000 people died, so many, not too long ago. And I bet you right now, I was just talking to another person. I said, like, oh, China's going through the post COVID-19 stage. I said, what is Liberia's current, stage? Because when you really think about it, what is their current stage? So it has to take the willingness of the government and advocates, people who are advocates. And when they get in there, they continue to be advocates, and they're just go to be what everybody else does when they get there to change things, because crises are going to come, and they can't just keep doing the same thing over and over and over again and keep putting people's lives at stake. Because, I mean, when are we going to learn that? People say they don't know about it, but most of these people who are there lived abroad before going there. They come back and forth, they visit America, they come for their vacation, when they come for their actual annual physicals and everything else to do, and they see that, they see how things are supposed to do, they know how things are supposed to be done, and they go there, and for some reason, things don't work out the way they're supposed to. Even the ones who said, we're for the people, and well, that's my spiel for today.
So Doug, what would you advise if you were talking to the health minister, as to how to go about this thing, combating the disease? What would be some of your suggestions?
Well, I would applaud that, they are learning from what others have done, and rapidly trying to implement the social distancing to prevent further community spread. But like Abby and Eva said, it requires so much more. They have to say, okay, how can we get this to work? And I can tell you here in Nashville, Davidson County, one of the things that we have had to deal with is our citizens who are homeless, experiencing homelessness, or unstably housed. So they might be sleeping on someone's sofa. So if you say quarantine yourself or self-isolate, where are they going to do that? And it was like, oh, wait a minute. So it's been, and as Abby mentioned, sometimes you get the politicians that there's a lot of wonderful talking, but putting that into action has taken a lot of work. I mean, we've spent 10, 14-hour days trying to find even a facility to accept these citizens while they wait for the test results. I remember one day just calling motel after motel after motel. So, it's good that they're coming up with this plan. I would tell the health officers there and the government that you have to be realistic. You can have that plan, but then what else are you going to put in place to ensure that people don't go out to the marketplace and stand there in packs, waiting to get food? What are you going to do to make sure that people are practicing frequent hand washing? Are they, does the government have money to put up certain mobile water station? I mean, it's going to take money, and the government will have to put money into it in order to mitigate the further spread, so they can say, hey, yes, Liberia was one of few countries that only had 3 cases. I had a number of cases under 10, but the government and the health officials will have to talk, and it's going to come down to money. There has to be a lot of money spent.
Thank you. Let me read a few comments on Facebook, and then we take one call online, then we'll be winding this down. Musu Stewart say, in Liberia, I think isolation as much as possible is the only advice. Go out only if extremely necessary. I'll respond to that, Musu. Every day for someone who lives hand to mouth, every day is extremely important for them to go out and buy food. or your charcoal or your oil. Then Dave just said, for wedding, it should not be too difficult to implement. If the population is limited to 10 and under that and under, it will cut costs. There is less burden to feed too many people at the wedding. This will socially advantage folks who could not get married due to the lack of resources. So let's take advantage of this crisis and get married to the person one loves. I think Dave is being, so let me bring on a let me bring on a caller. Gakon Moel, you are live. Or yes, where you calling from and your question or comment? Gakon.
Yes, hello, Jai. Thank you for the show, Chicago, Illinois. You know where we experiencing the lockdown over here. Thanks to all the panelists. I think they are providing adequate and relevant information as it relates to COVID-19. Thank you for clarifying that the chloroquine is not the best option as of yet, as has not yet been approved by FDA. Because I know a lot of Liberian people that are trying to get some. But in regards to our health minister, what the doctor said, I think my question would be, knowing the situation in Liberia, I know a lot of there has not been a lot of assessment, as it relates to COVID-19 and trying to see how we can adapt our own system rather than copying and pasting what is done in the Western world. What would be some I know earlier you asked that question, what would be some suggestion? Would you like suggest that they really assess the Liberian situation, then reconsider their recommendation that was just copy and paste? Because I think a lot of the copy and paste recommendation that was read by the health minister, I think it's not suitable to the Liberian situation, because I don't think it's ever going to work in Liberia. Because for one, businesses being shut down. Donald Trump is passing a $2 trillion stimulus package for small businesses. There's no plan as to how business is going to sustain in Liberia. So what will you all, because my recommendation would be to reassess the Liberian situation, then come back out with recommendation and not just copy and paste what is working in developing countries or in developed countries.
Yeah, I think they said like Keke. These people have to carry passengers. You say Keke should carry one person or two persons. Forget that. He's not going to do it.
Yes,
Churches, mosques, religious
right.
centers, and other places of worship are hereby order closed. I think it's easier for mosques because they don't collect offering, but for the churches that have to do the pastoral offering, the free will offering, I don't know how's that going to happen. So panelists,
but Jai, it's bad. It's bad. I'm sorry. It's bad that our government officials just copy and pasting recommendations from developed countries. It's sad. They're not putting no thought into this at all.
No, we can say that. Let's give our suggestions on what we think will be practical. So let's start with Eva. Eva, what are some of the practical things?
Well, I mean, I don't know if we should start with the practical or start with the unpractical because.
Okay, whatever side you take.
Because like the caller said, in Liberia, everybody has to go to the market every day to buy food. And I think one of our major things that we're not even assessing in Liberia is the environments. A lot of the environment in Liberia, especially with Monrovia, it is right now. The city is dirty. Red light is dirty. Waterside is dirty. So if you don't have even a clean environment to say you're going to be in, washing your hands is not going to help you, because you can be walking in the dirt, the dust, everything it can come on your clothes or so. People have to go out to the market and buy. And not everybody can afford even to say you go out to the market, you wear gloves. So I don't even think at this point, a lot of the cases that are coming into the country is not from within Liberia. I don't even think we've really closed the borders yet. That's one main thing I think we need to do. Close the borders, close the airports. All of our border entry points, try to
we get pepper from Guinea, so if you close the border.
well, at your entry points, have not just police officers, because like today I saw police officers that are basically kind of doing the work of what healthcare workers or healthcare volunteers or people that are trained that they're trying to do. They're in all these cars going around trying to enforce things, but you guys are in close quarters within this car too. You can contract it from one of each other, and then you're walking around to the neighborhoods and you can give it to people. So if you have like people, trucks coming in for the borders and things like that, have those people being checked. Check people, their temperatures. Try to triage the people at the entries at the airport, because from what I know, the 3 cases that have come in have all traveled to, have all brought it into the country instead of it being, you know, contracted within the country. So at this point, we still have people that are traveling back and forth and within the country, and we haven't closed the borders. That's one of the main things that I think we need to do, except for, like you said, for food. If you have trucks coming in with food, you have people can meet them at the border or figure out how we can do things like that. But I don't see the healthcare workers as engaged as they should be. You know, the police director walking around with a microphone telling people what they should do. I don't think it should come from him. It should come from one of the health officials, or like they did Ebola time, they passed out flyers. I don't hear anything on the radio and things like that, and reaching out to other places in the country, because if Ebola hits, it's going to hit like mostly from the borders. You know, have we reached in the interior to let people know things that they can do? So I think right now we're just on the surface, trying to scratch the surface of what needs to be done. And we haven't really put any plans. We haven't sat down to say, okay, we know we need to do isolation, but like the caller said, what is practical for Liberia? You can't say everybody stay inside. I know for churches, there shouldn't be churches, there shouldn't be schools, but if you take the children out of school, are we doing anything to balance that out with sending schoolwork home with them? How are we isolating everybody, but making sure the children get what they need and people get food?
Yeah. Doc?
Yes, I echo what Eva has said, and and the caller is right. Something the CDC says, they put out these recommendations, and if you read further, they'll say, look to your local health department, or look to your state. So the caller is right on. There are these recommendations that are made by WHO and CDC. And then you have to look at what's going on locally, what's going on within the country. And again, I say that, the health officials and the politicians have to sit down and have some true talk and come up with practical solutions. And that's, what has to be done and that would help the people to then adhere to some of these social distancing policies.
Right. And one, we heard from our West African correspondent yesterday that there is some tension in Guinea. The president is trying to stay in office, so he's trying to change the constitution. And that may cause some upheaval because people are going to go against that. And if that happens, the result will be an influx of refugees over the border to Liberia and Sierra Leone. And with this COVID-19 situation, that's scary. There's a question here. Dave Jar again says, I was watching Spoon TV live show, and the guy who claimed that he's a healthcare worker maintained that it is impossible for a virus to spread asymptomatically. What is your response to that person and those who may be paying attention to him?
I don't know why I don't know the basis of that comment, but there are many viruses that can spread asymptomatically, and we know from this evolving pandemic that there are people who said that they didn't have any symptoms, and they tested positive, now whether those the positive test, those viruses were alive or not alive. We don't know at this time, but there's more and more data that suggests that there is some spread in those who are asymptomatic.
Mm.
And that's the very basis of why we tell people, even though you have no symptoms, please stay inside and, you know, practice social distancing, because you can still pass it on to another person. So that's basically the question he just asked. Basically, it's like the direct opposite of the reason why we're telling people to, you know, practice social distancing and doing that, because even the younger ones who think they can't get it, they're passing it on to people who are sicker and elder relatives as well. So no. Yes, you can still pass it on even without symptoms. You can still pass it to somebody else. And that's common with most viruses too, but we're just going to keep it within context of COVID-19 right now. So.
I would say, that's something, and even to this day, sorry, Abby, I'll jump in with HIV, you know, and it's still to this day, after we've had HIV around for decades, people still think that, oh, because this person looks healthy, he or she cannot have HIV. I can show you a person who's 300 pounds that has HIV. So, you know, there are viruses that someone can pass along that we think that person is healthy, and even for COVID-19, to bring it back to COVID-19, maybe that sore throat or that achiness that person had, that was their symptom, and they just ignored it and said, oh, maybe it's my allergies coming up, or, you know, that fever that they had for that was 102, maybe the flu was coming on and I took that Julable and it went away. And they didn't know that was COVID-19, and they went around rubbing their nose, coughing or whatever else, and passed it along. So it's just so much we still have to learn about, you know, this new coronavirus.
Mm. And this is
probably rubbing up Vicks on them too. Remember back home we rubbed Vicks was the cure for everything. Vicks in the eyes and the ears and the nose. Oh God. Yeah.
And what's about, is this not pass through sex? That's it? And that's social distancing, should it include sexual encounters as well?
That's a good question. Health officials advise that if you know someone is ill, you please avoid, you know, kissing and, you know, and so far it hasn't, haven't seen any data that says it's passed through sex. But again, there's still a lot more we are learning. We have to learn about this novel coronavirus. What they look at is results from SARS, because SARS, severe acute respiratory syndrome, remember was from Asia, I believe China, back in 2003 or something like that. Yeah. And SARS and this novel coronavirus that causes COVID-19, they're similar. And so people are using information from SARS to try and gain information about this COVID-19. And for SARS, it was detected in blood, in respiratory secretions, in feces. And I think even there's been some publications from New England Journal of Medicine and others that have detected COVID-19 in feces. So back to the caller's question, as far as semen, we don't know yet, and I haven't seen any data or publications regarding that investigation.
Yeah, COVID-19, please stay away from semen. Gakon, you still on the call. You give your final thoughts, and then we are about to close. Gakon, are you still there? All right, he's gone. All right. I know there's a lot to cover on this subject, but if there's anything more or that we have not stated, you can just wrap that up in your closing comment. And especially, please mention, or Dr. Kaikai, about SARS and COVID-19. What's the difference and what, because SARS was treated and it was gone, so what's different about this one that is becoming so resistant? And then there's this question, is avian flu in this category similar to COVID-19?
No, avian flu is different. Is a different type of virus. Those are different virus types. So no, and SARS, for whatever reason, there were not as many cases worldwide. I mean, most of the SARS cases were in Asia, and then they traveled to other parts of the world. In the US, I think all the SARS cases were travel related. We didn't have many. So it appears that the SARS, even though they appear to be similar viruses, it was not spread as easily. And I think as time goes on, we'll be able to learn more of the differences between the two. So they're not exactly the same virus, but they're both SARS, MERS, and this novel coronavirus are thought to be beta coronaviruses. And so we'll just, as time goes on, we'll learn more about it. As with the other viruses, there's a peak and then it starts to come down. When exactly will that peak be? It's hard to say. The experts, like our epidemiologists, using different modeling and all that, and they say within the next few months, so we may have at least 4 more months or so to go. And then it'll start to come down. But key is that social distancing and staying at home when you're ill, and mitigating the spread of the of this illness. And we have to, as we all have said, just be realistic about what's practical in each city, each country, and try to do the best that we can, because we're also globally connected. Yeah. So we have to, so the countries have to help each other.
Right. And what's up with Asia? These things are coming from Asia a lot.
No comment on that.
All right. Abby.
My closing statement?
Yeah.
Okay. Well, I think we covered everything. Make sure you wash your hands. Keep your hands from your face. That's very difficult because I've been watching myself and I realized that I've touched my face at least 10 times in the past hour, which is instinctive for anybody to do. So please keep your hands away from your face. If you have to touch your face or scratch, you can always do the back of your hands. Make sure you wash your hands as much as possible. We always talk about hand washing. I do have a video on my forum, proper hand washing, because just washing your hands you can wash your hands anyways, okay, because you can do the best you can, but proper hand washing is the key to preventing yourself from getting sick and spreading this virus. Because when we wash our hands at work, annually they have the little blue ray, whatever it's called, and you can look there and see there's so dirty particles all over your hands. So please, if you remember my forum, Abby Tyler Healthy Living, sorry for plugging my forum, learn how to wash your hands properly, and if you're putting hand sanitizer on, you're making sure you're covering everything there. If you have rings on, go underneath there and rub it nicely. I have hand sanitizer at my front door, my back door. You walk into my house, you agree to wear hand sanitizer. And that was before all of this, because I've always been not a germaphobe, but I always, being in healthcare, I want to make sure when you're coming into my house, you're not infecting me. And for those of you who will still be going out to parties, funerals and everything else, just make sure you have hand sanitizer there. I won't advise anybody going out to any of those things right now, because anyways, most states have curfew. So Liberian party usually is supposed to start 8 o'clock and doesn't start till 10. So stay home as much as possible if you don't have to go. And finally, I want to give thanks to the other panelists. Also, to the unsung heroes out there, we have our dietary departments. They still have to take foods to the patients. We still, the transport, they call it orderlies. Most of these young men and women are like, anywhere from 19 to 25 years old. Their lives are also on the line. Our wonderful housekeeper environmental services, our IT department, who has to work so much harder now because most of the other non-essential people are working from home. So when we call them nurses and everything, we tell them to fix the computer, fix it now. So, everybody who's doing everything, our first responders, police, everybody, military, everybody who's doing the best they can to make this thing go away or just manageable for the next month or so. And our students who are from school, please stay strong. I know you all, especially I wrote on my forum about my son who's graduating, but there won't be any ceremony. So please take heart, stay safe, wash your hands, and just be there for each other. Call your elderly people because you can't visit them now. Call them and check up on them, check on your elderly neighbors and friends. So I thank you all for having me tonight, and have fun. Stay safe.
Eva, are you going to any party?
No, I'm not going anywhere.
You're close.
I'm at home. But Abby and Dr.
Sure.
Shaw has said it all. Just for people back home, for mainly is to, it's hard to follow these protocols, but follow it as much as you can. And my message is for the healthcare administration, because if the operations in any hospital or whatever is not running properly and things go through the cracks, work with your nurses, work with your doctors, come up with plans, come up with shifts, because it might reach a time where people will be overworked, people will get burned out. Write out a plan as to what you're going to do when that happens, to make sure that you have coverage at all times. It's better to be proactive than reactive. So just come up with these plans, sit down. While the storm is calm right now, I can say, and come up with a plan that's doable and that's feasible and that will work for our environment back home.
Well, I can't thank you enough for the time that you spent here. Hopefully next week, Sunday, we're going to do this again. Today should have actually been our discussion on chronic diseases, but the COVID-19 was just too much to ignore for this Sunday. We have had, last Sunday, we have had similar discussion. We're having it today again. And so next Sunday, we're going to be discussing with Abby and the rest of the team. And Dr. Shaw, if you can, please join us again next Sunday. We're going to be discussing chronic diseases. These are things very common among our population here in the US and back home in Liberia. So we want to talk about that. We want to thank you so much for your time. I want to thank all our viewers, those who participated. Sorry we couldn't read all the comments. Those who call in, want to say thank you so much. This is a tough time. I imagine you go outside, not many people you see that places are closed. And we hope that this thing really doesn't affect Liberia, because everything that we've touched when it comes to Liberia is impractical. We can't do the social distancing. We have to go in the market every day. There are no public bathrooms, so you can do, especially with us, the guys, you can do your business anywhere along the road and right there get some food and you buy something, you eat it. Where is the water for you to wash hands? So you keep moving. So the environment is really, really conducive for spread of this kind of thing. And we just have to pray and hope that it really doesn't get bad. And for those who want to politicize everything, please let's work together during this difficult time to make sure that our country is safe. We don't want to suffer another Ebola-like, crisis. We have yet to recover from that Ebola, and so we don't want anything like that. Let's do the best we can to keep our country safe. We want to say this video will be on YouTube. Subscribe to our YouTube channel. Keep supporting us. Focus on Liberia. Our goal here is to educate, to elevate, and promote all things Liberia. Until then, my name is Dennis Ja. On behalf of all of us here at Focus on Liberia, wishing you a good and godly night.
We all happy